Okay, so I'm going to tell you which one is going to start, who's going to be the next and the next one. For you to be alert, okay? Okay, so since we only have 4 students, Mariana Sanginés is going to start. And the second one is going to be Marcela Guzman. The third one will be Danita Urgoa, and the last one will be Brisa Montoya. Okay, so uh, I'll see you guys if we do not have this problem. I repeat, I'll see you later. Let's get started with Mariana. Okay. Hey Mariana, how are you doing?
Hello?
Hey, do you hear me?
Yes,
Okay, so how are you, Mariana?
I'm fine, thank you.
Okay, so yesterday we were talking about, well, the first part of the investigation topic, right? Which was actually laboratory studies. So, as we were saying yesterday, the first one, and I think the most usual test we ask for is a CBC, right? Do you remember what CBC stands for?
You mean the meaning?
Yes, of the letters CBC. Yes, that means stands for, right? CBC stands for.
Mhm.
Okay.
But I mean, you need a translation or you want me to explain what it's about?
I would like you first to tell me what each one of those letters mean.
Okay, CBC means complete blood count.
Okay. What would you use this for?
Well, it counts blood cells that are in our body and is a way that we can find um, certain levels that could be se me fue la palabra, could be like a help for us to get to a diagnosis.
Okay, so it will be, well, this test actually could give us some clues, right, to build our
Mhm.
diagnosis. Okay, okay, what would you, what would be important to diagnose, well, let's say you have this patient that is coming to your consultation, and this person is telling you that is well, always is having a headache, always gets headaches. Okay, this person is really pale. um, After walking 3 blocks, this person starts feeling shortness of breath, um, and the peripheral oxygenation is let's say 87%. What would you expect to find in your CBC?
Um, well, just because I don't really know about the last signs you mentioned, but
Okay.
because of the topic and the first sign that you mentioned, it could be anemia.
Okay. So
if
when
I'm right.
and how would you describe in clinical features this? Well, you know what a syndrome is, right?
Yeah.
Could you tell me what you know about it? What syndrome is?
You mean about anemia?
Any kind of syndrome. Just tell me what
What?
syndrome means to you.
It's about the symptoms and signs that have a determined disease.
Could be related to, for example, we have nephritic syndrome, right? It is, well, this nephritic syndrome is not related to a certain disease. It could be related to a group of diseases. So a syndrome is actually what you just told me, just like a group, right, of symptoms and
Mm.
signs that could be related to a group of diseases. And from then on, you have to investigate the main cause, or the main cause of this syndrome. So in this case, before you ask for a CBC, what would your diagnosis be? What would you write down?
Um, well, when we want to confirm our diagnosis, we uh, want to we want to do more um, tests and labs that will confirm our diagnosis, but um, we would have to check all symptoms and signs that the patient has. You
Okay.
mean that?
Okay. When before asking for any kind of laboratory test, you have to write your diagnosis, right? And when you have your patient and your consultation is done, when you ask for before you ask for a blood test, in this case a CBC, you have to write down a diagnosis according to the symptoms and signs that I told you. What would your diagnosis be?
Um,
I mean, you are
well,
suspecting like anemia, right?
yeah.
Okay, but that anemia actually, anemia is not a diagnosis. It has to be a syndrome. Anemic syndrome would be the diagnosis before you get your labs. Okay, and when you get
Okay.
your labs, then you can confirm your diagnosis. Before doing it, you only could be talking about anemic syndrome. For example, a patient who has leukemia might not have any kind of clinical feature that is going to direct you into the leukemia diagnosis. This patient would first have in clinical features just anemic syndrome, right? And when you get your lab, then you will confirm or redirect your diagnosis. Okay, so you get your anemic syndrome. What would you expect to find in your CBC?
Well, when we have anemia, um, uh, like hemoglobin levels,
Hemoglobin.
hemoglobin
Yeah.
uh, levels are going to be low, if I am not wrong.
Okay. What else?
That's all I remember. Really.
Okay. Did you get to read this topic, anemia, for example?
Mm,
Did you get to the hematology?
Not really. I don't really know about this. Well, all about these diseases you mentioned yesterday in class.
Okay.
yet.
Do you know any kind of, let's say, do you know anything about infections, maybe? Any kind of infection?
Well, not about infections. I know the process of infection and what is going to be shown in the body because of that.
Okay. What would you find in a patient who has an infection?
Um, well, infections are because there is something that shouldn't be there. So they might cause different signs like I think it says swollenness,
Uh,
like
like
inflammation.
swollen,
Yeah,
swollen. Okay. Okay. Swollen. And
and
any
that
other, okay, so inflammation, right? And some
yeah,
part of the body which has some microbial agent could
yeah.
be causing an infection, right? So
Mm.
what else would you find before, besides inflammation?
Well, damage because of that. So
Okay, let's say, for example, you have, well, this patient, a patient that might have pneumonia. Okay, this is an infection, right?
mhm.
And in the lungs. So,
Mm,
the what would the first or the main clinical features this patient might have?
the main one. Mm,
Clinical features, which is signs, symptoms, all
mm,
that kind of stuff, are clinical features. Okay, características
yeah, I
clínicas.
know.
Okay.
Yes. Well, in in this disease we have um, cough, and I don't remember how you pronounce bronchius.
Uh, what do you want to say?
Well, I could explain in Spanish, but I don't want to.
Try to do
um,
it in English. You can, so you can get rid of the doubts.
yeah, just I forgot how to pronounce words, the parts of the lungs.
Okay.
Well, there are parts of the lungs that are obstruct because an infection. Um, that's all I can explain in English. I don't really know how else to say.
In any kind of infection, you're going to, well, this patient is going to have fever.
Yeah.
Okay. Why would this? Do you know the mechanism of fever or what it? Well, I mean, it helps us actually, right? Helps our patients. It's like a reflex. Have you read about fever yet? What are you? Are you a sophomore, junior, a senior student? What year are you in?
Um, I am a physical therapist. I am
Okay,
not a med student.
okay,
Um,
Mariana. Um, you are going to have a lot of patients with, for example, pneumonia, right?
mm,
Because you help them with physical therapy, according, well, to help them get rid of some secretions, right? Like pus mainly. Patients in when I was in my residency, I saw patients with COVID pneumonia, and they couldn't get rid of some secretions, and
mm,
so we had to call physical therapist to help them get rid of that secretion, because I mean they're always well, they have the ventilation machine, right? So they cannot, well, they are like sleeping all the time, so they cannot cough it up, right? You know what cough up is, right? We talked about it.
Mm.
And they cannot cough up, so they cannot get rid of that. So you're going to get a lot of patients with pneumonia who are unconscious when you go to the ICU. Do you remember what ICU is?
Intensive care unit.
Yes,
It was a
intensive care unit. Yes, terapia intensiva, right? So
yeah.
when you go to that service, you're going to get a lot of patients with that, and you're going to help them with, well, to get rid of some secretions. So
Mm,
um, in any kind of in any kind of infection, our patients have fever. It is like the common rule. However, it is not always what we get. In patients who have are immune compromised, like HIV, okay, sorry, like HIV, or some people that are elderly people. You know what an elderly person is, right?
yeah.
Those kind of people may not have fever. So if a patient, let's say an 82-year-old patient, goes to consultation and feels really down, um, does not have fever, starts talking incoherences, um, is dreamy most part of the day, the first thing we have to um, think of as a diagnosis would be pneumonia. Okay, in patients who are elderly people do not always have or present fever. In people who are young and previously healthy, we always get fever, talking about diseases. In the next topics that we're going to talk about when we continue the investigations part, such as X-ray and MRI, especially X-ray for you, right? And you're going to get that a lot.
Mm.
You're going to teach us, okay? Okay, so we're done with your 15 minutes, and I'll see you at the end of the class for the survey, okay?
Okay.
Okay, see you later.
See you.
Hi.
Hey, Marcela, how are you doing?
Fine. How are you?
I'm fine, thanks for asking. So give me 1 second. I'm going to, okay. So from now on, we have your 15 minutes. Um, Yesterday, we were talking about some investigations, and the first one that we talked about yesterday was about CBC, right? Could you tell me what CBC stands for?
Well, I remember it was about how can I explain you this? From blood test.
Okay, but there are three letters, right? CBC. Do you know the meaning of each one?
I think it's well, I don't remember exactly. Exactly like what was the meaning. Sorry.
Okay, it's complete blood count. Okay, complete blood count. In Spanish, it would be hemograma. Okay. Okay. So, what do you think this blood test is useful for?
Well, for example, a while ago we were talking about some um, yeah, for example, when someone has anemia or there is a cancer of the blood cell. Well, not the blood cells exactly, but there is a cancer. What is this one? I forgot, but mainly it's for see the count of blood as we know, and it will help us to see if the if there is any problem with the measure of the cells. So it will help to to keep someone to see if there is any normal parameter. How can I say it?
Okay, yeah. We actually call it normal ranges, right?
Normal ranges.
Yes. Okay. So, talking about, for example, an infection, what would you expect to find in CBC?
I think it would be maybe it will be an increase in the count of blood cells because they will try to go over the virus or something like that.
What kind of cells would be, will have a higher count?
Maybe white cells.
Okay. White blood cells, right?
Mhm.
Okay. So let's say, what would you expect to find in a patient who has a bacterial infection? What kind of white blood cells would be increased?
I really forgot about this one.
Okay. Do you remember, did you, are you a sophomore student, a junior student, a senior student? What year are you in?
Actually, on my second year.
Okay. You, I think you might have read about physiology subject, right?
Yes.
Okay, so what, and in the first year, also you in histology, right? You'll also uh, read about the types of white blood cells. Do you remember what types of white blood cells there are?
They were. Can I say it in Spanish?
Okay, but then you're going to say it in English after you say it in Spanish. Okay.
I remember there was a blastocitos.
Sorry.
Blastocitos.
Those are the immature forms, right?
Uh-huh.
Okay. 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 You know, what else? It's in English would be blasts, just blast cells. Okay. Yeah. Actually, in peripheral blood, we do not have blasts. If we actually find some blasts in peripheral blood, in a peripheral blood sample, we would actually have to think about leukemia. So in peripheral blood, we do not have blasts in normal circumstances. Okay. So what other cells do you know? White
Uh,
blood cells, of course.
Linfocitos B y T.
Okay. Actually, you're going to repeat after me the pronunciation. Okay. It would be
Okay.
lymphocytes, right? B lymphocytes and T lymphocytes, right?
Lymphocytes and T lymphocytes.
Lymphocytes, yes. However, most people will ask, you and I are doctors, right? We actually would call them B cells and T cells, okay? But the correct way would be lymphocytes, as we already said. However, they are also known as B and T cells, Okay, just cells like any other cell, B cell and T cell. Okay, what any other kind of cell do you know?
Um, monocitos.
Sorry, I didn't.
Monocitos.
Okay, monocytes. Okay, and okay, is there any cell related to monocytes?
Los macrófagos.
Okay, macrophages.
Macrophage. What is it?
Yes, you said it right.
Um,
Okay,
could you tell me how can I write that one? Because it's a little bit confusing for me.
which one?
Macrophago.
Macrophage.
Yes.
Yes, that is, you said it right. You know, like uh, the PH sounds like an F, right? And does it sound like any organ of the digestive system? Maybe the esophagus, right? Phagus, phagus. So actually both words come from Phages, okay? Which actually means eat. It's like a Greek origin, which means eat. So these monocytes and macrophages usually eat, right? And do you remember the process by which
I
they
well,
eat bacteria, for example? They start destroying bacteria.
I know if there is there, they when the system find out there is any um, how can I say cuerpo extraño?
Okay, like what?
Because I have heard like in an explanation like if there is something abnormal in the blood, here comes the macrophages
Yes.
and like involve these bacteria and like there, it's like saying just as a simple like this they eat it.
Yeah. Yes. Okay. Uh, so what any other cell is related to phagos? In Spanish it would be phagocytosis, right? Do you remember? Is there any other cell related to this process?
Mm, uh, um, I think there is I'm trying to remember because it wasn't it was not like a long ago, but it's a while ago since I don't talk about this.
This kind of stuff.
Yes.
Okay.
But,
Okay, you're doing great.
okay.
Do you remember neutrophils? In Spanish, neutrófilos?
Um, I think so.
Okay, those cells and macrophages and monocytes and of course the neutrophils are related to infections. When there's a bacteria that is in any of our tissues, uh, they create an immune response, right?
Mhm.
And this immune response make these cells, especially these three ones that we already mentioned, increase their concentration. So when we have when a patient of yours has any kind of infection, a serious infection, for example, pneumonia, which is quite common, is going to uh, the leukocytes, the white blood cells, are going to be increased, right? In a CBC, you're going to see this increased number of leukocytes. And this increased number of leukocytes is called, do you remember?
Mm, No, actually no.
Leukocytosis.
Because leukocytosis.
Okay, Leukocytosis. Okay, leukocytosis. That is the increased number of white blood cells. Do you you must have read about the normal ranges of leukocytes. Do you remember?
It will be between um mm, mm. It will be between 115 and no, sorry. I'm a little bit nervous, so I'm running with numbers.
Okay.
Um, it will be between 150 no 50,000 and 440,000 millimeters. I don't know if I'm wrong, but I remember that.
Okay. You just said 5,000 or something like that, right?
And I say 150,000 and 440,000.
Okay. Actually, the normal ranges of leukocytes count of white blood cells go between 5,000 and 10,000. Okay.
That's too high.
Yes, really high. However, these are the normal ranges of white blood cells. If we have lower counts than 5,000, right? We just said the normal ranges are between 5,000 and 10,000, right? If we have lower numbers than 5,000, this is called leukopenia. Leukopenia, okay? A decreased number of white blood cells is leukopenia, okay? And a higher number than 10,000 is leukocytosis, okay? So in a patient who has, for example, pneumonia that I was telling you about, our patients have leukocytosis. And one of those, they have leukocytosis, right? However, there are some types of cells that are related to certain conditions. For example, we just said that neutrophils are related to infection, right?
Mhm.
What about basophils? Do you remember this in Spanish, basófilos? What are those related to?
I think they are related to, mm, for example, when someone has like any infection, I think they come and help the body to, um, or for example, I don't know. Well, there is this is common like when the weather changes just a little bit, the someone gets some allergies or something like that, and so I remember that
Yeah.
these cells help to in those cases.
Okay, great. So allergies, right?
Yes.
Okay, great. And what about the other one? We have neutrophils, basophils, and the last one. Do you remember the last type of cell?
And then these ones are monocytes.